Good day. Today I am going to do PRS procedure or Platelet Rich Stroma procedure for a 49-year-old lady. She is a resident of Mayiladuthurai in Tamil Nadu. She has been suffering from knee pain for the last 5 years. Her pain is of very severe intensity. She has only tried native medicine like Siddha treatment and some tablets and maybe ointments. She does not suffer from any other illnesses, skin disease. She does not have involvement of any other joints suggesting an inflammatory cause like rheumatoid arthritis. So these are the x-rays of the patient here. This is the right knee and this is the left knee. There is decrease in the joint space on the inner side on the right knee. The outer joint space is preserved. On the left knee, there is no joint space at all on the inner side as well as the outer side. So, on a scale of 1 to 4, this is a grade 4 osteoarthritis by Albeck's classification or Kellgren-Lawrence classification. There is no joint space at all. On the lateral x-rays also, there is joint space preservation here. On the lateral x-rays here, there is no joint space at all. Same with the Merchant skyline views, there is joint space here. No joint space on the outer side of the undersurface of the kneecap. This is a very challenging case. She had been to another hospital in Coimbatore where she was advised a knee replacement. She was vehemently against a knee replacement and so she came to me just 2 days back. I got an MRI scan done the very same day. I got the findings and sent to me, and yesterday I reviewed her and I posted her for surgery. She has undergone the procedure today as usual, bilateral platelet rich stroma procedures, and in addition I also gave her genicular nerve block. I in fact did ablation of the genicular nerves. Genicular nerves are the nerves carry sensation from the knees to the brain. I ablated these nerves, 4 nerves in each leg, upper, lower on the inner side, upper on the outer side and the central nerve. So this is called as a genicular nerve ablation. I used alcohol, 60% alcohol to ablate the nerves. What alcohol does is it denatures the nerve. A gap is formed in the nerve and that gap cannot be bridged over easily. So the result will last for a long time. Pain sensation will not be carried from the knee joint to the brain and she will get pain relief. This pain relief from the genicular nerve ablation will hopefully start immediately today, and we'll see her through the rest few days when she is still recovering from the PRS procedure. Then the result of the PRS procedure, that is the stem cells anti-inflammatory effect, the growth factors and all that will start very soon. And later after 3 days, I'll be starting her on Extracorporeal Shock Wave Shock Wave Therapy. That's also a major boost. So it's like a triple stage rocket booster treatment for osteoarthritis. Like the SpaceX program, this treatment with the genicular nerve block, PRS treatment, extracorporeal shock wave therapy, physiotherapy, vastus quadriceps stimulation and all that should really improve the condition of the patient. We should wait and see. So these are the x-rays. So I discussed these x-rays because they are of the severity of it. I will show you the procedure in the next video. If you want to see more videos like this when they come out in future, like this video, share it with your friends, subscribe to my channel Madras Joint Replacement Center. I will see you in the next video. Cheers.